recording. Okay, perfect. Okay, good afternoon, Dr. Potgieter, and welcome everybody. It's Fertility Talk Live. And today, unfortunately, we weren't able to go live to Facebook, but we'll record it and put it live on all the different channels that we have. So thank you, Dr. Potgieter, for joining us today on Fertility Talk Live. It's always great to hear you. We love your happy, chappy atmosphere that you always bring around to us. So we're talking about endometriosis, but before we get into that, can I please ask you to just tell us who you are, tell us what you do, and where
Sure.
you're from.
No, so good afternoon, everyone, and thank you for the opportunity. And Leanne, thank you for the opportunity to talk. And it's always nice to talk to you. And I think knowledge is power, and I think that if we can empower women to know what they're dealing with, then it's easier to deal with a problem. So I'm situated at Mediclinic Kloof, and we are part of Genesis Fertility Clinic, and I also work with Dr. De Bruin and Dr. Potgieter, and together we tackle the endometriosis, and yeah, we are happy to help. And yeah, so if you need us, we like I say, we are at Mediclinic Kloof, and then we can take it from there.
Okay, perfect. So we're talking about endometriosis. And if the subject is not really spoken about a lot, we talk a lot about PCOS, and we talk a lot about fallopian tubes, but endometriosis is something I think people are still very silent about it. So please tell me, what is endometriosis, first of all?
So I think, in the last couple of years, we've diagnosed a lot of endometriosis because our technology has improved so much. In other words, the laparoscopes that we use, the technology has improved in such a way that we can actually now see when we go into the cavity what it is. So endometriosis is basically where the lining of the womb or the endometrium grows in different places than it should. So it grows, apart from the endometrium, it contains stroma and glands, and it grows in the fallopian tubes, it grows on the bowel, it grows in the pelvic sidewalls, and it can grow on the ovary and cause cysts. So it can cause, it can grow basically anywhere. And we actually, at the moment, if you look at the research, we're not 100% sure what the cause of endometriosis is, but what we do know is that there's definitely a genetic trait to it. So in other words, if your mother or grandmother had endometriosis, and the way that the endometriosis is normally diagnosed is by when the woman feels that their periods are abnormal, they are sore, painful, difficult having intercourse with their partners. And then also the other big aspect is obviously infertility. So yes, it's common. It's common. It's much more common than we think. And if you look at the fertility fraternity, it's very, very common. And yes, definitely, it grows outside in the pelvis. So if you menstruate, then we always say that it feels like the whole pelvis menstruates. And a lot of my patients will tell me, doctor, it feels like my uterus is going to fall out. And it's so painful. And you need really to deal with this kind of problem is that you need to see endometriosis specialist, to deal with this kind of problem, because you need to be really specialized. So if you look at endometriosis, it grows like cancer, but it's not cancer. It won't kill you, but it becomes rock hard as cement, and your whole pelvis becomes rock hard, and your life can really become a misery, and it can affect your life, your quality of life, and all of that. And some of these patients have it so badly, and they even feel they want to commit suicide, or they feel depressed. So it's really something that you need to understand the disease process. And the other thing is also that one must understand that it's chronic. So in other words, what we mean by chronic is it's not, you're not going to see the doctor once and then all of a sudden your problem is sorted. You're going to have to go with your endometriosis specialist, and you'll have to Obviously, we'll talk about the treatments later on, but you're going to have to almost walk with your doctor through your reproductive life to help you to overcome this.
Okay. The next question is, what causes endometriosis?
So like we said, we think the cause is, we're not 100% sure. We definitely know that there's a genetic disposition to it. And what we also know is that the old analogy that we always use is that we talk about the so-called retrograde menstruation. So that means that those endometrium, instead of going down to the vagina and outside the body into the pad or into the tampon, that endometrial fluid goes backwards and actually gets into the pelvis. But I think all types of, but some women don't, have, most women can have retrograde menstruation, and not all women develop endometriosis. So there's definitely some sort of a link that we still need to find. And so obviously there's a lot of research going on, and I'm sure in the future we will definitely become closer to the real problem. Yeah.
Okay. What are the symptoms of endometriosis?
So this is what makes it so difficult, because some women might have a lot of endometriosis and have no pain, and then you have patients who maybe have stage 1 or stage 2 endometriosis that can have a huge amount of pain. So it really that's what makes it difficult to understand. So it's definitely not the same for all the women, but we know that if you certain things that certain symptoms that you get that does actually make us aware of it is when the women tell you that the amount my menstruation is changing in the way that it's becoming extremely heavy. Doctor, when I'm menstruating, I can't get out of bed. I cannot go to work. I've got so much pain. I just want to lie and cry and roll myself into a bundle. And, I cannot, get to work. And then the other thing is sometimes you might even find that the pain now starts becoming between the periods. And also that the other problem is a lot of women have pain after sex or during intercourse. In other words, so once they've had intercourse, they have severe pain, or during intercourse or after intercourse. And then sometimes if it's very severe, women, when they urinate, it's painful. When the bladder is involved, or sometimes what can happen is if they've got, if the endometriosis grows with the bowel, it can cause closure of the bowel, and it can have women can have difficulty passing stool if it in severe cases. So you can have you can basically have all that symptoms, but I think it's important for the endometriosis specialist to say, well, okay, we need to work out exactly, where is the problem, and you need to basically see what is the cause of the pain. Sometimes you can have pelvic infections, sometimes you can have pelvic spasm, the pelvic floor can have spasm, and sometimes you might not have any problems with your women parts, you just have problems with the bowel. Now, problems with the bowel, you can have irritable bowel disease, you can have Crohn's disease, all these inflammatory, ulcerative colitis. So it is, some of these symptoms can mimic each other in a very same way. But it is important that to understand that endometriosis and the symptoms of endometriosis is definitely affecting your quality of life. Women won't come to you if they don't have a problem. They'll come to you. And the problem is that we see is that what the patients tell us, that they feel that sometimes the doctors feel that their symptoms are just being gaslighted. They are not heard. And I feel that if a woman is really having problems and pain, then you need to go and have a look and find the problem. Because there's obviously somewhere there's a problem. It might not be obvious, but you're going to have to work with it and find out where's the problem. So those are the other thing that I wanted to say as well is, apart from the pain and the discomfort, Leanne, and the stools and urine, is the problem of fertility. So women who've got endometriosis can also have problems falling pregnant. And the reason why that is because as the endometriosis grows in the pelvis and it affects the ovary and it affects the fallopian tube, it causes scar tissue. So in other words, when you ovulate, that the fimbriae or the little fingers, as I can say it, as it were, of the fallopian tube cannot pick up that oocyte or that egg properly. So then it causes infertility in such a way because of all the scar tissue. And then you can also, patients can present with endometriosis, and then they can also present with endometrioma. So that's where you have these cysts that develop on the ovary, and they cause these typical chocolate cysts. And that causes difficulty to ovulate, and it causes severe pain, and all of that obviously affects the so-called anti-Miller hormone level of the woman. So the anti-Miller hormone level is that amount of eggs that you have left, and you ovulate. So, okay, but can you still fall pregnant? Yes or no?
Yeah.
Mm.
Okay. And another thing also that I'm always seeing a lot of women posting is that their tummies are quite big. It's enlarged. You know, they actually look pregnant with
They do,
endometriosis,
and
that's
it's
very
also
painful.
so definitely you can feel that. So I definitely think that the endometriosis also affects the bowel function, and it does cause this. Women say that they feel pregnant, and definitely they do have that symptoms. And absolutely, that is correct. Absolutely correct. Yeah.
So a question is, how is it diagnosed?
Well, the thing is, in the old days or younger days, we always said that you know, you need to go and do a laparoscopy. So do a laparoscopy, take a biopsy, and send it for histology, and they will confirm the endometriosis. But these days, if you look at the big societies like ESRE, which is the European Society, and all of that, they will say to you that if you suspect endometriosis, you can already start the treatment of endometriosis. But the best way to diagnose it is by doing a biopsy, doing a laparoscopy. If it's very severely, and in other words, if you've got like stage 3 or 4 endometriosis, you can see the endometriomas on scan. You can actually see bowel lesions. You can actually see the movement of the uterus. We talk about the so-called sliding sign, and all these things that you can actually look at to see, you know, if the uterus and the bowel and the ovaries involved. So the ultrasound today helps us a lot. There's also other things that you can do. You can do an MRI. The MRI is obviously more expensive, but it can also help us. So in very difficult cases where it's difficult to see, then we sometimes do an MRI.
Okay. The last question we have is, what treatment options are available for endometriosis at Genesis?
Yeah, so basically what we do with our patients is that we would like to, you know, kind of like work out what the problem is. And then I think it's important that you need to look at the patient and also what other previous treatment they've had. So in our situation, we have a lot of patients that are already referred from our colleagues to us for infertility or endometriosis. And in those cases, our colleagues, the other gynecologists, have already tried the medical treatment. So if you don't have, so generally what you try and do is you try and do a medical treatment. So if it's like a stage 1 or stage 2, which is low grade endometriosis, then one can obviously look at using the medical treatment. So what does medical treatment mean? Medical treatments mean that they will help with the symptoms, but they won't necessarily take the endometriosis away. In other words, what we are saying is we can use non-steroidal anti-inflammatories, and you can use the so-called the COX-2 inhibitors, which is more safer on your stomach, and that helps. And we normally say that you must take that 2 to 3 days before your menses, because it helps for the pain. Then the other option that one can do is with your combined oral contraceptive is you can use that, but you can also skip your placebo tablets. In other words, what we are saying is that you, for 3 months, you take the active tablet, and then you only menstruate every 3rd month. And that also helps to try, because the idea is that we try and decrease the amount of menstruation, because that's where obviously the pain is going to be. There's other hormonal things that you can use as well. The so-called GnRH agonists, Those are the injectable depots that you get. What they do is basically they decrease the impulses from the brain to the ovary. In other words, what they say then the ovary stops producing more estrogen and progesterone. What then happens is, so that it's almost like the pelvis cools down a bit. You can do it for 3 to 6 months. But if you do it for longer, then a woman can go into menopause. So then you have to do the so-called, what we call add-back therapy. You have to give estrogen again because it can have an effect on your bones. So that's very important. So that's what we can also use. There is other aromatase inhibitors and things that you can use. You can obviously ask your doctor about that. And then the big other one that we use is the so-called Dynogest or the Vazan. And we know the Vazan has been really been proven now to help women. And also it's also just been approved for, we can use it for up to 8 years. So it's really a good, the thing is, it's just important, like we say, is that you have to tell the patient that you must remember that you're not going to see your periods when you're on Vazan. And Vazan has the similar effect that it takes your period away. It's not a contraceptive, but later on it acts like a contraceptive. But in the beginning, it's still important that you do take some extra protection if you do not want to fall pregnant. And then it's important also that you, after certain interval periods, that you do a bone mineral density to make sure that you do make sure that your bones are still not falling behind, that you don't develop osteoporosis. Because remember now what's happening, you actually have an environment of where you have decreased estrogen. Hey? So that is definitely important. And then, so the Vazan is, we've helped a lot of women with the Vazan. Unfortunately, there is some women that you cannot use Vazan for. And because they've got severe side effects, they feel that they get moody and all sorts of side effects. But I think the main thing is that I think one mustn't say, well, I'm not going to use Vazan because my friend said she felt terrible with it. I think one must always try and experience something for yourself and make sure that, you know, if the doctor does prescribe it, see if it works for yourself. Try that for at least 3 months and see if you do get any side effects or whatever the case is. And then obviously there's other things that you can do, is you can do the so-called intrauterine contraceptive device. And though the big one that we all know is the so-called Mirena with the added levonorgestrel. And that is also very good because it helps you to control the pain in a way that you don't menstruate, or you menstruate very little. It's also good for your, you know, for contraception, but it definitely does improve your quality of life. And I think then obviously once you've exhausted the medical things, but if you have severe endometriosis, then we know that surgery, if you've got deep infiltrating endometriosis, in other words, endometriosis that are in the bowel, in the ovary, and all over, then we know that for sure that surgery is probably the best option. And it's when you need to go to a surgical endometriosis excision specialist. In other words, somebody who knows how to deal with this and knows how to actually cut out, we can say cut out the, so in other words, we want to be very aggressive towards the endometriosis, but we must be very careful that we don't have a defect in function. In other words, because if you operate in the pelvis, you've got some structures that can be damaged during, so you need to know somebody that knows how to do those operations. And we know that certain things can be involved, like the pipe that runs from the kidney to the bladder is called the ureter. That can be involved with endometriosis. So sometimes you can get damage on the ureter, which is dangerous. So it's really surgery that needs to be done by somebody who knows what they are doing. And then obviously the bladder, the bowel, the ovary. In some cases where the bowel is obstructed, we have to do a bowel resection. In other words, what we are saying is then we have to either do the so-called shaving. In other words, we go and we take a scissor and we shave off the endometriosis from the bowel. Sometimes we do a discoid resection. So discoid resection is where we take a disc out of the bowel with a circular stapler. And sometimes if it's very severe and it's long and it's like 3 to 5 centimeters, then we do a segmental resection. In other words, then a little a small part or a part of the rectum has been, or the rectum has been removed, and then we re-anastomose the two parts again. And in some cases where it's so bad, where you can't use your large bowel again, some women, they end up getting an ileostomy. In other words, they do ileostomy, and they first diverge the stools away so that rectum can heal, and then after 3 to 6 months, then that colostomy or that ileostomy is reverted back so that everything can work normally again. But those are in patients that are obviously have severe cases. So yeah, it's Leanne, a big topic. A big topic.
Quite a big topic.
Yeah,
I'm
big topic.
cringing
And
as you're telling me all these things. I'm actually like just cringing to hear all the
and can you tell me? But we've seen the ladies, and if you are so hard up and your life is messed up with severe endometriosis, the woman will tell you that they feel, once they've had the excision surgery, they feel better almost immediately. So there is definitely, some things that we can do. And then obviously, if you are wanting to fall pregnant and you have endometriosis, then obviously your doctor will decide, well, in which way you're going to do it. Are you first going to have the surgery, or do you first have to get your eggs extracted before you go for the surgery? So there's all these different ways and means of how you going to tackle the problem. But I think the most important thing is that I think what I want to give today is hope. I want to give the women hope. And I want to say to them, don't suffer in silence. There is help for endometriosis. And the thing is just what you must do is some women live with this because they feel periods should be like that. And it's actually, it should not be like that. And I think, I've seen women that have burnt themselves with warm water bottles on their skin because they've got so much pain. People don't completely underestimate the effect of what endometriosis can have. And also the employers normally don't understand that people, can be off work because of all of that. So it's important for your doctor to write good communication to your employer to say, but this lady has got stage 4 endometriosis, and this is why she's coming for surgery, or, this is the symptoms that she's having. It's not something that you make up and you just don't want to work. It's really something that are very serious. And what we see then is once we've excised the endometriosis, then our pregnancy rates also improve. So, because the endometriosis produces the prostaglandins and all these things that are negative for pregnancy. So once we've treated it, then your chances of falling pregnant is obviously much, much better. But I think I want to really say that there's hope, and you get help and go and speak to somebody. If there's a problem, get help. Speak to an excision specialist. We've got a few in the country that are working very well. There's also the Facebook group for endometriosis warriors. I'm sure that with Rochelle Helstinger, that's been doing that for a couple of years. And I'm sure that we've helped a lot of women with this problem. And, and I'm sure that we will be able to help lots more women. And we enjoy to do this kind of work because we know it works. If you do something for a patient and it works, then it makes you feel good, and you can see your patient is also much happier.
Okay, that's awesome. Thank you very much, Doctor, for this talk. It's always amazing to listen to you, and the advice that you're giving women, and also the hope that you're also bringing to them. I don't know if you want to please give your details again to those women that are dealing with endometriosis and also trying to conceive. If you can just give them your details and Genesis details as well of how to contact you.
So we are Mediclinic Kloof in room 111. You can just go and Google Dr. Dries Potgieter. All the details will come up, and then if the fertility needs to be looked at as well, then we're part of the Genesis Reproductive Centre. So you can also go and Google that. We also have Instagram page. You can go and have a look. We put weekly, we put new messages on there. So yeah, I think what nice is technology makes us to be able to interact. You know, we don't have to, you know, in the olden days, you know, try and phone and then somebody's not available because they're out. You know, these days we can look at each other, we can talk, we can give advice, we can hear, and we can do all these things like I'm doing now with you.
Yeah.
So yeah.
Okay, thank you very much, Doctor, and have a great weekend.
I look
We'll
forward to
chat soon.
speak to you again, Leanne.
Absolutely. Thank you. Bye.
Bye-bye.